What can be done for a lifelong permafrown? I've had a permafrown, permanent frown, my whole life, 32 years. The corners of my mouth remain downturned at all times, even when smiling. Is there anything that can be done so that I can actually smile? Thanks in advance for the help.
Thank you for your question. You provided a single photo and you refer to your condition situation with your mouth as having a permafrown or a permanent frown that's present even when you're smiling. And what I suspect you're referring to is the way the outer corners kind of point downward even when you smile. And you're looking for a solution. Well, I can certainly give you some guidance to how I explain the options to my patients who share this similar type of situation, whether it's genetic or a result of facial aging. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and helping people maximize and improve their appearance non-surgically as well as surgically is essentially the core of my practice. So let's just discuss a little bit about anatomy and the relevant anatomy and how we address this type of issue. So in terms of let's say the movement of the mouth and the relative position of the outer corners of the lips, there are basically two approaches. One is to use a neurotoxin such as Botox, Dysport, to relax muscles to allow unopposed action of other muscles. I'll explain more about that. And the second thing is to use fillers. And what do fillers do? Well, fillers essentially provide volume in places where volume enhancement can actually create the perception of a subtle but significant enough change. So let's start with the neurotoxin concept. There are several muscles that are around the lips that determine the position at different areas of expression or times of expression. So one of the things we do is something called a Botox lip lift. And what that means is injections are placed in an area from the outer corner of the mouth and right near the jawline to relax the muscle. This muscle is called the depressor anguli oris muscle. And what that does is, because that muscle depresses the outer corners of the mouth, and when it's relaxed, the outer corners actually slightly elevate. And so that when you're smiling, it can come up, the outer corners can come up a little bit. So it's referred to as a lip lift, or using the most common and most popular neurotoxin, Botox. Now, of course, this is something that has to be done consistently. So it wears off. The neurotoxin does wear off anywhere from 3 to 6 months. So consider this in factoring in whether you'd like to do this with any frequency. But I think it's reasonable to try out, because if you don't like it, or if things don't go in a way that you want, it wears off, and that's pretty nice about non-surgical procedures. The second option I would consider is use of a filler to try to soften the depth of the line and to try to create a little bit of fullness at the junction. And typically I would use a softer hyaluronic acid filler, something in the Restylane or Juvederm family. Now that can create a little bit of a support, almost like a pillar, to lift the outer corners of the mouth. So I think that combination will give you a little bit more of a smile than without anything. It doesn't make a total change, but I think it'll make enough of a change that you can at least see if you like that, and then you can do that with some consistency. Yeah, and there are surgical procedures and different types of suspension procedures that have generally been tried to do something more permanently, but from my perspective, I don't find those to be that beneficial and consistent. So I still feel like the injectable fillers have the most significant and reproducible role in this. And of course, it's something that's not surgery, it's just an office visit. There are a lot of ways to enhance the area around the mouth, and there are many different ways to enhance the different areas outside of the outer corners. And so a more global look at your whole face and the anatomy may also open up some opportunities to consider. So meet with qualified, experienced doctors who perform these types of injectables and learn about your options, and then take the first step in trying something out so you can see if you like the result and if you are willing, of course, to keep that type of procedure ongoing so you maintain a certain look. So I hope that was helpful. I wish you the best of luck, and thank you for your question.